we can look at this and take this as an opportunity to reinvent ourselves, become more effective, become more efficient, even in regard to food waste.
And joining me now is Dr. Phil Knight. He is the Executive Director of the Food Bank Council of Michigan. Phil, it's good to see you.
Thank you. It's great to be with you.
Give us a sense what food insecurity was in the state of Michigan pre-COVID and now what we're dealing with.
Yeah, so right before the schools closed, we were probably looking at about 1.4 million people across the state that were food insecure. That is, they were living under the toxic stress of where's my next meal going to come from? What am I going to give my kids? And probably of that 1.4 million, then we're probably talking about 400,000 of those being children.
So now in a COVID-19 world where we have people who have lost their jobs and we have people that are in situations that they never dreamed that they would be in, what are food banks facing around the state?
Yeah, great question, because that's really like the third wave of people that have come to us seeking food, people who've never had to negotiate the emergency food network before. So contract workers, folks that are in the service industry, maybe employees of small businesses, they're coming to us because they make too much money prior to COVID to qualify for any federal program. So they're coming to the food bank network. And it's while it's sad, it's also pretty inspiring to see these folks pull into these drive-through distributions and see the quality of food and just watch that stress, that toxic stress of being food insecure wash away.
So you're really dealing with multiple layers of people who are now in need. And would you say that this is the largest need that the state of Michigan and the food bank system has seen?
By far, by far. The first wave was the students and their families, particularly the students who are on free and reduced breakfast and lunch at school. That was the first wave. The second wave was senior citizens, the most vulnerable population. So we created a program that actually would put food on their porch so they didn't have to come out. So we had the innocent with the student, the most vulnerable with the seniors, and now this third wave with people who've never had to come to us before.
So what are the logistics in terms of making sure that there is enough? What are some of the food banks around? And I know it will vary from parts of the state, telling you in terms of running out of goods and keeping that supply chain going of donation.
So it's, again, it's a great question, because prior to COVID, we were probably distributing at the 7 Feeding America food banks that serve all of Michigan's 83 counties, 2.5, 2.8 million pounds of food across the state as a network. Since COVID, we're well over 4 million pounds of food across the state.
Do you think that number is going to go up, Phil?
I think it'll maintain this level for some time. COVID's going to have a long tail. Just because the economy starts to re-engage doesn't mean we're all suddenly whole financially. So it's going to take some time. And we're projecting this alongside the food insecurity rate, alongside of the unemployment rate. So we're preparing to last till 2022.
All right. So how do you even prepare for something like that and really doubling what your organizations have to do in a matter of weeks?
So these guys that are the leaders of these food banks are logistical geniuses. And if they're not, they hired one. And so they're so passionate about this work. And Christy, really what's encouraging in all this is that people have come alongside of us. Michiganders have come alongside of us. We're getting a lot of donations, getting a lot of food, lots of great programming coming out of the federal government, USDA. And so I think with everybody continuing to work together and coming alongside of us, we can get through it and make sure that we have the right amount of food getting to the right people at the right time.
What are your biggest concerns, though, in terms of supply? We've read some reports where people are queuing up and they're waiting, but by 11 o'clock in the morning, they're out of certain items or they're out of food entirely. How do you change that? And where are some of the supply chain breakdowns or I guess problems that you can solve?
Yeah, so I think probably the thing that if all of us, those of us who are blessed enough to be able to go to the store and get what we want or what we need, if we'll just make sure during these days to buy what we need for our family, then it will lessen the stress on the supply chain. So there'll be more food that will go into the emergency food network, not just the retail network.
What about, let's talk specifically at Southeast Michigan. Are they seeing a larger surge than other parts of the state?
Yeah, so Gleaners Community Food Bank and Forgotten Harvest, both serving Southeast Michigan, definitely have seen the greatest uptick, following right along the path of the COVID outbreak. Doesn't mean that rural hunger is not important, and it doesn't mean that it's not still present with us, but just the sheer numbers of people that have been exposed in Southeast Michigan has led to a tremendous need for people to have food. There was a great need before. Now this just gets magnified inside the pandemic.
And Phil, can you describe for me, I think the accompanied trauma that people don't realize that goes along with families and food insecurity, and especially for people who have been living through this and now who are feeling it even worse, that their economic budge is even worse than it was before, or for people who are experiencing this for the first time, the lasting effects of food insecurity.
Yeah, so Christy, if most of us are blessed enough that we've never had to ask ourselves the question, what am I going to eat and what am I going to give my children? To live under that toxic stress, under blue skies, outside of a pandemic, is a debilitating stress because there's always trade-offs. I got more month than I do money, so am I not going to pay my rent so I can buy food or my prescriptions or utility? What am I going to do? Put that inside a pandemic where you're constantly threatened about your own health and the health of your children. It's debilitating. And I don't know how I really define heroes a little bit differently inside this pandemic than I did outside. And that's the people who are able to deal with this stress and still do what's right, try to get up, try to do what's right. And these folks that are working in the food banks, they're my heroes for sure.
Let me ask you about that. What have been some of the logistical concerns in terms of keeping employees safe and setting up maybe even a different delivery system for food and for families because of COVID and your workforce?
Yeah, as soon as the governor declared the state of emergency and schools closed, we knew that our 3,000 pantries across Michigan would not be as well utilized just because people were going to be scared to come in and to mix. And this is before we knew anything really too much about social distancing and mask and all that. So we designed a drive-through mobile distribution so that people could just drive in their car and declare to us they needed emergency food, tell us how many people are in their household, and we had prepackaged quarantine boxes with shelf-stable, highly nutritional food, 22 meals in each of those boxes. And that's how we've been distributing the food ever since.
I guess when you talk about, you said 3,000 pantries across the state of Michigan, what are some of the calls that you are getting, some of the unique ways that these food pantries have found a way, like you talk about the drive-through system, to be able to reach people?
So pretty cool partnership. We developed senior quarantine boxes so we could build those boxes in our warehouse. And then Carolyn Bloodworth from Consumers Foundation reached out to me and said, hey, Phil, we've got trucks and drivers. Can you use them? And they have been delivering this food to seniors who would call in and say, hey, I need food. I'm concerned. I don't want to get out. And they've literally been able to put that on their front porch.
Talk about the stress of operating, and you're talking about the 400 million tons of food that you are going to be distributing, and you think for the foreseeable future. Is the system built, and the food pantry delivery system built to sustain that kind of level and stress over the long haul?
I don't think so. I don't think emotionally, physically, mentally, if we continue to work at with the same infrastructure before as we are current, we can ramp up for the crisis. We've done that. But I think that our leadership will have to take a step back and allow COVID to do things for us instead of just against us. And what I mean by that is we can look at this and take this as an opportunity to reinvent ourselves, become more effective, become more efficient, even in regard to food waste and how we can incorporate more and rescue more of that food. So we're going to have to take a step back and really be able to say, if the community is going to need us to continue to distribute over 4 million pounds of food a week, we can't do it the way we were structured 11 weeks ago.
So what keeps you up at night, Phil?
I think that the same thing that probably before COVID, and I can't take, Christy, I can't take the kids. When kids are without food, I don't sleep well. So I think that they're innocent. And I just think that everything that we can do, every dollar we can invest, every effort we can make for both children and for senior citizens says a lot more about us than it does about them being in need.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.